If you woke up this morning and noticed something, that your feet were swollen again, or your fingers were numb, maybe you wiggled your toes, stood up slowly, and thought, it'll go away by afternoon. It always does. Maybe you've been thinking that for weeks, maybe months. Then you need to see this video. My name is Dr. Ben Walker. I've been practicing internal medicine for over 20 years. And in that time, I have sat across from hundreds of patients, good people, careful people, people who went to every single checkup, who said those exact same words to me. It goes away by afternoon, doctor. I figured it was nothing. Some of them were right. It was nothing serious. But some of them were very wrong. And by the time they sat in my office, the window for easy intervention had already closed. Here's what nobody tells you, and this is what I want you to hear before anything else. Swelling that shows up in the morning, after a full night of rest, after hours of lying flat with your legs elevated, that is physiologically different from swelling after a long day on your feet. Your body is not supposed to accumulate fluid while you sleep. When it does, something is working against you, something that has a name, something that can be found and treated, but only if you don't wait. I'm going to share 5 specific warning signs with you today that will tell you whether your morning swelling is harmless or whether your body is sending you an urgent signal you cannot afford to ignore any longer. But before that, in the comments, tell me your age and how long you've been waking up to this, because you are not alone in this. And what you're about to learn in the next few minutes might be the most important thing you watch all year. Don't go anywhere. Let me tell you about Max. 73 years old, retired school teacher from Ohio, proud grandfather of 4. Max was the kind of man who never complained. Spent 40 years on his feet in a classroom. So when his ankles started swelling in the mornings about 2 years ago, he did what millions of Americans do every single day. He assumed it was just tired legs, just aging. He'd elevate his feet in the evening, the swelling would go down, and by morning it was back. Same cycle, every day. His wife Margaret noticed it before he did. She asked him about it at least a dozen times. Max always had the same answer. It goes away by evening, it's fine. Here's what nobody told Max, and here's what nobody may have told you. Swelling that appears overnight while you're lying flat and resting is physiologically different from swelling that appears after a long day of standing. When your legs are elevated during sleep and fluid still accumulates, that is your cardiovascular system sending a distress signal. That is not normal aging. That is your heart, your kidneys, or your veins telling you something is wrong. Max went to his doctor. His doctor, a good doctor, a well-meaning doctor, saw the swelling, noted it in the chart, and said his blood pressure medication might be causing it. He was on amlodipine, which is a calcium channel blocker, and yes, fluid retention is a known side effect. So the doctor reduced his dose slightly and told Max to watch it. The swelling continued. Max assumed the medication was still adjusting. 3 weeks later, Max woke up at 2 a.m., unable to breathe, lying flat. He had to sit straight up just to catch his breath. Margaret called 911. At the emergency room, the cardiologist on call took one look at his chest X-ray and told Margaret something that stopped her cold. Max was in congestive heart failure. His heart had been struggling for months. His left ventricle, the main pumping chamber, was operating at only 30% of normal capacity. The medical term is reduced ejection fraction, which means his heart was pumping out less than a third of the blood it should with every beat. The morning swelling wasn't a medication side effect. It was fluid backing up because Max's heart couldn't pump efficiently enough to keep it moving. And for nearly 4 months, that signal was there every single morning, waiting to be read correctly. Max spent 11 days in the hospital. He's managing now on a complex medication regimen with significant lifestyle restrictions. But his cardiologist told him something that I want every single person watching this to hear. If you had come in 2 months earlier, we could have intervened before the damage progressed this far. 2 months. That's the difference between early intervention and permanent heart damage. How does this happen? How do well-meaning doctors miss this? And how do millions of people walk around for months with a warning sign this serious and dismiss it? That is exactly what I want to break down for you now. Here's the uncomfortable truth about morning foot swelling. It has multiple possible causes, and not all of them are equally dangerous. But 3 of them are serious enough that they require immediate medical evaluation, and most people, and honestly some general practitioners, don't always distinguish between them quickly enough. The first is heart failure, which Max's story illustrated. When your heart muscle weakens, blood doesn't circulate efficiently. Fluid leaks out of your capillaries and pools in your lower extremities due to gravity. At night, lying flat, that fluid redistributes, but in advanced cases, it still accumulates because the underlying pump is failing. Research published in the Journal of the American College of Cardiology has shown that approximately 6.2 million Americans are currently living with heart failure, and nearly half of new diagnoses occur in people who who had visible edema swelling for 3 months or longer before their diagnosis. 3 months of warning signs, ignored or misattributed. The second major cause is kidney dysfunction. Your kidneys regulate fluid balance in your body. When they begin to fail, and chronic kidney disease affects roughly 37 million Americans, many of whom don't know it, they lose the ability to properly filter excess sodium and fluid. That fluid accumulates in your tissues. It shows up first in your feet and ankles because fluid follows gravity. A 2022 analysis from the NIH's National Institute of Diabetes found that 40% of adults over 65 with moderate chronic kidney disease had lower extremity edema as their most visible early symptom, yet only a fraction connected that swelling to their kidney function without a physician specifically ordering kidney function labs. The third cause, and this one is critical, pay close attention, is deep vein thrombosis, or DVT. This means a blood clot has formed in the deep veins of your leg. DVT can cause swelling, warmth, and sometimes pain in one leg. But here's what makes it genuinely terrifying. That clot can break loose and travel to your lungs, causing a pulmonary embolism, which can be fatal within minutes. The CDC estimates that between 60, 0, and 100, 0 Americans die from pulmonary embolism every year, and DVT is frequently dismissed in older adults as routine leg swelling. Now, and this is where it gets important. I told you there are 5 specific warning signs that tell you your swelling is a medical emergency, not just discomfort. I'm almost ready to give you those. But first, I need to tell you about 2 more people whose stories you need to hear. Comment right now if you or someone you love has ever had swollen feet attributed to just aging or just medication. Because what I'm hearing from thousands of viewers is that this is far more common than it should be. Linda was 69, a retired nurse from Florida, which makes her story especially painful. She knew medicine. She knew the body. When her left ankle started swelling about 18 months ago, she assumed it was chronic venous insufficiency, which is a common condition where the valves in your leg veins weaken and allow blood to pool. Entirely reasonable assumption. She wore compression stockings, elevated her leg, did everything right, but the swelling was only in one leg, not both, and it was slightly warm to the touch. Linda, despite her training, delayed going in for 2 weeks because she was sure she knew what it was. When she finally went to urgent care, a Doppler ultrasound confirmed a large deep vein thrombosis in her left femoral vein. She was admitted immediately, started on blood thinners, and monitored for 48 hours for signs of pulmonary embolism. She was lucky. The clot didn't travel, but her physician told her that the 2-week delay meant the clot had time to grow significantly larger, complicating her treatment. Linda told me, and I'm sharing this with her permission, I knew better, and I still waited. Imagine what someone without medical training does. Then there's Robert. 77 years old, retired engineer from Texas, type 2 diabetic for 15 years. Robert's swelling was bilateral, both feet and ankles, every morning. His A1C was poorly controlled, and his nephrologist had been monitoring his kidney function for years. His swelling worsened noticeably over about 6 weeks. His wife brought it up at his next routine appointment. His doctor ordered a comprehensive metabolic panel and found his creatinine levels had jumped significantly, a marker of rapid kidney function decline. Robert was referred to a nephrologist urgently and began a treatment protocol that, his doctor said, likely prevented him from reaching end-stage renal failure within the following year. Robert's outcome was good because his wife noticed the change and pushed for it to be addressed. Not because the system caught it automatically, because one person paid attention and refused to accept, it's probably fine. That detail matters. Write it down if you need to. Now, the 5 warning signs that your morning swelling is a medical emergency, not a nuisance. First, the swelling is present when you wake up, before you've been on your feet at all. Normal fluid retention from a long day resolves overnight. Swelling that greets you in the morning when you've been horizontal for 7 or 8 hours is your cardiovascular or renal system telling you it cannot manage fluid properly, even at rest. Second, the swelling is in only one leg, particularly if it's accompanied by warmth, redness, or pain in the calf. This asymmetry is a classic DVT presentation. Do not wait. Go to an emergency room or urgent care that same day and ask specifically for a Doppler ultrasound. Third, you experience shortness of breath when lying flat, or you find yourself needing more pillows to sleep comfortably than you did 6 months ago. This is called orthopnea, and it is a hallmark sign of heart failure. Your heart cannot manage the fluid redistribution that occurs when you lie down. Fourth, you press your finger firmly into the swollen area for 5 seconds and release it, and the indentation stays visible for several seconds. This is called pitting edema. A small amount is less concerning. Significant pitting edema, especially combined with morning timing, warrants urgent evaluation. Fifth, Your swelling has worsened progressively over 2 to 4 weeks, not stayed stable. Stable mild swelling in both ankles in a 75-year-old with no other symptoms is often benign. Swelling that is getting worse week over week is a trajectory that demands investigation. If you have any combination of 2 or more of these signs, please do not wait for your next scheduled appointment. Call your doctor today. Tell them specifically what you're observing. Use the word progressive if it applies. That word changes how urgently your call is handled. Now, let me give you a practical protocol, 5 steps you can take starting today. First, begin tracking your swelling with the same discipline you track your blood pressure. Every morning before you get out of bed, look at your feet and ankles. Notice, is it both feet or one? Is it better, worse, or the same as yesterday? Write it down with a date. This record is clinically valuable. It transforms a vague complaint into objective data your doctor can use. Second, weigh yourself every morning, same time, before eating or drinking. Sudden weight gain of 2 or more pounds in 24 hours, or 5 pounds in a week, is a recognized clinical indicator of fluid retention, serious enough that many cardiologists tell their heart failure patients to call immediately if it occurs. A scale is one of the most powerful diagnostic tools available in your home. Third, ask your doctor specifically, not generally, to review every medication you're currently taking for edema as a side effect. Calcium channel blockers, corticosteroids, certain diabetes medications, and NSAIDs like ibuprofen can all cause or worsen swelling. This isn't about stopping your medication without guidance. It's about having an informed conversation where you know the right questions to ask. Fourth, request that your next blood work include a BNP or NT-proBNP level if you have morning swelling with any shortness of breath. BNP stands for B-type natriuretic peptide. It's a protein your heart releases when it's under stress. It is a sensitive early marker for heart failure that is not included in routine panels. You have to ask for it specifically. Fifth, if your swelling is in one leg only with any warmth or pain, skip the doctor's office and go directly to urgent care or an ER and ask for a venous Doppler ultrasound by name. Do not let anyone tell you to wait and see for a unilateral presentation. You have the right to advocate for that test. You might be wondering, my doctor sees me regularly. Wouldn't they have caught this already? And this is a fair, important question. The honest answer is that a 10-minute primary care appointment with a 70-year-old patient managing 5 or 6 conditions simultaneously creates real constraints on how deeply any single symptom gets investigated unless the patient specifically raises it as a priority concern. The system isn't corrupt, it's overloaded, which means your job is to be specific, persistent, and informed. That's not distrust of your doctor, that's partnership. You might also be wondering whether compression stockings are enough. For benign chronic venous insufficiency, yes, they help significantly. But compression stockings do not treat heart failure. They do not dissolve blood clots. They manage a symptom, not a cause. Use them if your doctor recommends them, but don't let them replace the investigation. And if you're thinking, I've had this for years and nothing bad has happened, I want to gently push back on that. Max thought the same thing. So did Linda. The absence of a crisis so far is not confirmation that there isn't one building. It may simply mean you haven't yet reached a threshold where the body can no longer compensate. I want to return to my father for a moment. He was a physician. He spent his career telling patients exactly what I've told you today. And when it was his own feet, his own morning, his own body, he called it old age. I was visiting that weekend and I pushed him hard. I said, Dad, you know what this could mean. You've told patients this 100 times. He looked at me and said, it's different when it's you. He went in the following Monday. His BNP was elevated, early stage heart failure. He started treatment immediately before any hospitalization, before any crisis, before any permanent damage. He's 78 now. He's still practicing part-time. He still gives me grief about everything, but I think about the other version of that story constantly. The version where he didn't go in. The version where I didn't push. You might be someone's Max, or you might be someone's Margaret, the person who notices, who asks, who pushes. Either way, what you do with this information in the next 24 hours matters. If your feet are swollen when you wake up, not occasionally, not once after a long flight, but regularly, progressively, please take it seriously today. Track it, weigh yourself tomorrow morning, and call your doctor if you see any of the 5 warning signs I described. Share this video with one person in your life who needs to hear it. A parent, a spouse, a friend who keeps dismissing their swelling. One share could genuinely change what happens to them. If you're going to call your doctor this week because of what you heard today, comment calling my doctor below. If you already have swelling you've been ignoring, comment checking tomorrow. And if someone you love has already been through something like Max's story, share it below. because your experience might be the thing that finally convinces someone else to act. Your body's been talking to you. This video is just the translator. Stay well and don't wait.